Hey guys, welcome back to Notice That, an EMDR podcast. We are post-holiday season. Bridger and I are in studio.
That's right.
And ready for another exciting episode.
Yeah.
How was your break?
That was good. A lot of family time, which is great. And then the shift back into the regular swing has been an adjustment to children under 3. So they're not loving the the switch back. Every morning, my oldest Goldie wakes up and says, "Let's go play." And
come on, Dad, you're supposed to be here all day.
There's this thing called a watch, and there's time on it, and we have to obey that today.
And there's work. And,
yeah. So that's really tough. But other than that, it was awesome. Lots of family still in town. Yeah.
Well, coming back yesterday, I was very brain fog and trying to get in the swing of it, but felt fresher today and excited for our episode.
Very
excited to get back to recording, and feels like it's been like a month.
Literally has been
since we've recorded. So, well, we get to come back with a bang. A really exciting interview.
Yeah.
We get to talk about sex today.
That's right.
Sex, intimacy, pleasure. Fun topics.
Very fun and also filled with lots of things for our clients and people, just in general.
Could be fun. Could maybe fun. Not be fun.
Right. Yeah.
But we're going to try to make it fun. We're going to let this be exciting. So we have a guest today who specializes in sex therapy, intimacy, pleasure, as well as several other things. Cassie, welcome to Notice That. Thank you so much for joining us.
Thank you. I'm so happy to be here with both of you.
Yeah, it's great to see you.
Will you share with our listeners a little bit about you, what you do, and kind of your background coming into practicing EMDR, kind of with a lot of other things, but specifically with sex therapy?
Yeah, sure. So I'm Cassie Krajewski, and I'm a licensed clinical social worker and an AASECT-certified sex therapist. I work in a private practice in Denver, Colorado, and have been practicing for almost 12 years, which is pretty wild to think about. But I received my sex therapy training as I was starting graduate school. So I've been in the sexual health space for a long time. And I left grad school not really sure what I would do with sex therapy specifically. I'll come back to that in a minute. But when I left, I had this kind of compilation of all kinds of different experiences in my early work, like working with eating disorders and addictions of all kinds, and eventually entered private practice. And lo and behold, all of these things started to intersect and make sense. So eating disorders, addiction, and sex. And you think about all of these involve the body, all of these involve pleasure or pain to some degree. And so now this is kind of the intersection at which I work and practice clinically. And I added EMDR into my practice back in 2015. And so I've been practicing as an EMDR therapist for 10 years, have loved the AIP model. It's my home base in which I primarily work now, including all of those things that I just mentioned. And I am an approved consultant in EMDR. I've been doing that since 2019 and have done a few advanced trainings and some different topics. And now I work as a co-founder of Iris Training Collective, which offers trainings, trauma responsive trainings, and specifically EMDR. So that's a little bit of what I do now. And I was so thrilled that the two of you invited me to come on to talk about sex because this is not a topic that is maybe so common in therapy world in general, but specifically EMDR. So I'm really, really excited to bring all of that together with you both today.
Yeah, lovely. Part of my curiosity just in hearing what you shared, this is very much from the counselor educator background that I have, but I find that therapists somewhat are on a spectrum of theoretical or clinical integration, where you have some that I see this presentation show up in my clients over a pattern, and so I want to go get trained in this thing, and then I do that for that specific population. That's on one side of the spectrum, and then on the other are really robust integrative philosophies of I'm not just reaching into a tool bag to grab one thing because I see an immediate need. I'm bringing a conceptualization foundation to every case that I work with, and I'm bringing along modalities that weave together into an integrated treatment plan. And it feels to me like you're much more on that end of the spectrum with all that you mentioned. Does it feel that way to you? And I'm curious if you could kind of describe what it feels like to have that integrative web of different approaches and conceptualizations.
I wish I could give myself credit for being so thoughtful and philosophical. It's only in retrospect that it has ended up that way. And what a thoughtful question. I love it. I think a lot of what I do feel it, as you've described it, very, very aligned with my approach, which is integrative, and it's formed a lot about who I am. And a lot of it's informed from my own lived and living experience that led me to these directions. And isn't it so interesting that they all intersect, right?
Yeah.
And actually, the more that I pursue the things that make me feel alive or interested or curious, really do fit together in this greater puzzle of how I understand all of us, our psyches, our consciousness, our bodies. So it's been really cool to see how these things intersect. I have joked that do you know the Enneagram?
Oh, yes.
So I'm an Enneagram 7, and one of my little shame spots as an Enneagram 7 is like I have such a variety of interests. Like I get bored very easily, and I always want to do something new. And I was critical of myself for a long time in my career. Like I need to settle down and like find a lane, and just so happens that actually with space and time and practice and some really good mentorship from other people, that it's cultivated into something that's really holistic and allows me to move in a way that feels really exciting in my work, and both to practice and with clients, but also to work with other clinicians and support them in developing that framework for themselves, whatever that might be.
Yeah.
You've mentioned AIP as a part of your theoretical conceptualization.
Home base, as she called it, which I love that. Yeah.
How does your background with sex therapy come in as a conceptualization tool? So not just like intervention, modality, technique, but more from that theoretical perspective or case conceptualization.
Yeah, absolutely. So AIP to me means that we are wired for health and wellness. And if we were to remove the things that are stuck, the barriers that get lodged into our systems, we will pursue that health and wellness. That is what our bodies and nervous systems want for us. And so I think that's essential for sex. We are sexual beings. We are embodied beings, which means that we are sexual.
Mm-hmm.
We are erotic. And that doesn't even necessarily mean a particular act or particular partnership or behavior. Just sexuality is a creative, generative energy that we all have, right? And that is within us. It is a birthright. And then things happen that disrupt that for us. And so from an AIP perspective, we can understand that as if we work to remove, whether it's the experiences or the lack of accurate information to support someone, they can find and pursue and tap into this beautiful, magnificent, magical energy of sexuality and eroticism that gives so much meaning and pleasure and depth to our embodied existence. And so I think it's so beautiful. It's not so much that I have to teach someone something. It's I need to help them remember and reclaim, which is I think a lot of what we're doing in EMDR is connecting people with that inherent system that wants to move them in that direction.
Yeah.
And we have such a strategic way of doing it by targeting the things, whether it's memories, experiences, beliefs, sensations, whatever it might be, that have interrupted that embodiment for us in that birthright.
We spoke a bit about this before we started recording, but just to speak for however long about what sex is in our cultural understanding of it, and we as therapists as well, because what you just said, I think a majority of our listeners would agree with, that sexuality is a facet of what it means to be human. But I think the nuance and meaning that you're seeing in it and what it actually implies for day-to-day wellness and what different things might come along that take that away from us or make us feel alienated from it, whether it creates awkwardness or avoidance or hesitation. Like, in what ways can we, I think, recenter our focus on what sex actually is?
Yeah, absolutely. Sex and sexual health and pleasure are essential components to our overall health and wellness, right? You think about the wheel of wellness, and they'll usually break it down like physical health, mental health, emotional health,
Social health.
spiritual health. Sexual health is essential. A part of it doesn't matter if you're having sex with someone or by yourself. It's an essential aspect of who we are. And when our sexuality is well nurtured and tended to, it supports our overall well-being. And one of the things that I teach in consultation is that, we can heal from sexual trauma, but actually helping someone heal their sexuality and pursue pleasure is a healing mechanism because of this, because our sexual health is a part of our overall health. And we see this cited by the World Health Organization too. They include sexual health as a part of their health agenda in that organization. And they define that not just as the absence of dysfunction or disease, but the pursuit of wellness and pleasure, which I think is so amazing that on this world scale, this is recognized. And, it's in some circles, that's pretty radical, that's there, but it's so true. And you can even reflect on your own experience around, like, what does my sexual health mean to me, regardless of whether I'm having sex with myself or someone else. Like, we kind of have to detach like behavior for a minute and more around the energy that comes with being sexually healthy.
Yeah, you said in some circles that it's wild to see how kind of distant or far away that can feel. It was immediately brought back to our context being here in Missouri and the Midwest. And with my clinical practice, sexuality always feels like, when I bring it up with clients, it's like this, big, like, oh, are we actually going to get into this? Or like, how do I talk about this? And I think there's a cultural element to that as well, where what you just said, the absence of disease or disorder, that's when you're needing to talk about sex. I would say in our culture in general, is like, this is when we talk about sex. Other than that, we're not talking about it. I don't know how you would feel, Jen, but...
Yeah, when you mentioned the region that we're in, the entanglement between sexuality and the religious undertones and kind of messaging here, we say we're in the Bible Belt in Springfield, Missouri, with a heavy influence in the AG kind of background. And so I feel like I see that constantly
in my clients.
Like, it is, not only is it an avoided topic, but it's a topic of deep shame and really a difference of belief around, is my sexuality actually a part of me to celebrate and to be in touch with and to find expression of, or does it come with specific contingencies and restrictions and boundaries in order for it to be acceptable and appropriate?
Wow, I really get that. So I grew up in the Midwest. I grew up in the state of Michigan in a religious community, and there were a lot of social norms and family values that really got played out in all areas of embodiment, I would say, but especially sex.
Yeah.
And, I think that it's a real target for social conditioning, and the root of sexual shame is so culturally reinforced, both in, I think, certainly religious, certain religious or faith communities, but I think also just greater culture. Like, I live in the United States, so I can speak to that more directly, where it's this kind of mix match where we're so sexually shame. We feel so much sexual shame. And yet simultaneously, we live in such a hyper-sexualized culture that it is so confusing to navigate, and let alone all of us probably received an abysmal sex education,
right?
If we got one at all.
Right.
And so commonly, I work with a lot of a lot of women or femmes who tell me, we never talked about sex at my house ever. It wasn't a validated aspect of my identity or what I did, or I got the message that my body was gross, dirty, wrong, disgusting, sinful. So these are some big messages that reinforce that sexual shame. And when we think about what are the roadblocks that get in the way of us pursuing our sexual health, these are the things that come up, especially as we look at like the treatment process,
Yeah.
right? How we might start to unhook and delink some of these things.
Yeah. When you started introducing the topic of like conceptualizing through the lens of sexuality, the way that you talk about it and the energy and the positivity, I think it's a contagious energy that you have about it. And I just hope for our listeners that there's, even if for some, that this is the first resource of hearing sex talked about with that excitement and energy and positivity. I think for therapists, for our clients, we need to be able to encounter someone that holds that view and perspective when some of those roadblocks have started early in development, from the first words we're hearing about our body and the first sexual experiences that we're having or exploration that we're having is met with shame, is met with criticism. The way that you talked about there may be the first time of hearing someone use those words around it being an expression of ourselves that's about health.
And a beautiful thing.
Yes.
I think not just like it's okay to have, but like you said, celebrated earlier. To me, that's the energy and implication that this conversation is putting out there. It's like it's a beautiful, gorgeous element of what it means to be human.
And that if our first reaction to the topic of sex, pleasure, desire, intimacy is one of fear or grief or shame, or it's an adverse response, that's not a place of shame, but it's a place of pause and curiosity to say, what might that roadblock be? What might have come in to block this like flow of health and energy that I have in a sexuality as a human? What could that be, and where did that come from? And I think that's work not just for our clients, that's work for us too as therapists, because that's going to shift the way that we bring these topics into the room and the energy we hold about it, or the questions we're willing to ask, or maybe the questions we're trying to avoid. So we may have that same like pause and curiosity for ourselves in the process.
Absolutely. I think that it is a really provocative topic, and meaning it should move you in some way. Or if it doesn't, like that's interesting. That makes sense somehow. And perhaps the work there is to consider, how does that make sense given my past experience, right?
Yeah.
Like opening the door to notice without judgment, whatever is coming up for me as I think about sexuality and eroticism and pleasure is all good data. That's all good data for me. And we are not immune as clinicians from this culture that we live in, the experiences that we have, whether on a macro scale or an interpersonal scale. It's if you haven't done some work on your relationship to sex, I think it's maybe something to consider.
Yeah.
And I think for some of us, we've never had the opportunity, or we haven't valued it in a way, or even known like what's possible here. So I just double doses of compassion for anyone who might even be having shame about their sexual shame, which is, of course, it's so normative. And you've not done anything wrong if that's your experience. And also, there's a gentle invitation of maybe that work is waiting for you when the timing is right.
Yeah, because it is coming into the room with your clients as these topics start to come up, and the way your strategies for responding to that topic or idea are also coming into the room. And so for me, like with working with counseling students or working with therapists in consultation, practicing just this deconstruction of even a concept like sex, when that word shows up, what's the feeling, and where does your body start to go in memory, in experience, in messaging, because that is showing up in the room, even if you think it's not. Like, no, we don't talk about sex, so my philosophy around it isn't coming up. And just as you said earlier, it's like, well, that is the thing that's coming into the room, is the omission of the prioritization.
Yeah, I think it's interesting to do a little mental audit of your caseload, to note in what therapeutic relationships and clinical work have I asked questions directly about sex, or sexuality, and where has it not come up at all, or I haven't asked. And you might notice some interesting data from that, like, oh, it's actually much more easy to invite that, or that client brings that in so fluidly, and this is my response to it. Or, let's say your client has sexual trauma,
Right.
and there's a lot of activation in their system around sex, and so you're tiptoeing around it. That certainly makes sense too. But going through a mental audit and just noticing, like, how has the theme of sexuality, eroticism, pleasure weaved its way into this work or not?
Yeah.
That feels like that could be a nice identifier of like blind spots that we may have as clinicians. Like if it's across the board on all cases, oh, I don't know anything about sexuality with my clients or anything about pleasure with my clients, maybe a point to pause and say, could that be a blind spot of my own? I'm thinking of a resource I saw on your site. I think it was history taking for sex therapy or something related to that. It was like a free resource. And
Yeah.
I'm curious if you could share a bit with our listeners about how would you recommend practically that they could bring in this as an element of their conceptualization or history taking? Where would you start? What kind of questions would you ask? What would be a way to start integrating this more?
Yeah, beautiful question. I think one of the key principles that I have in all of my work, but especially as it relates to sexuality, is consent. And so as I'm thinking about, like, to what degree do I bring in sexuality, I want to ensure I'm doing that with the client's consent to do that. However, usually, as a part of my general first meeting with a client, I will ask the question, what concerns do you have related to sexuality, sexual health, or intimacy? And I'm not asking, do you? Yes or no. It's
What?
normalizing, like, what concerns? Because of course, all of us would have some kind of concern, perhaps if we were to really be honest with ourselves, or something that, you have a curiosity around. So I ask that routinely, just to normalize it, introduce that concept into the space, make it okay to talk about. And then the follow-up question to that is, would you like us to focus on any of these concerns together? So asking for permission. This is a big part of sex therapy. We call it the implicit model, but it's asking for permission. And if someone doesn't want to bring it into the work, we're not going to, right? They need to be in the driver's seat with that. If someone does identify concerns, or maybe they say yes, but they don't have a lot of languaging around it, again, we might ask, would it be okay if I asked a few more follow-up questions about that? And I created that free history-taking resource to help support finding some language around how to ascertain and how to get at some of that data. Our clients may not be empowered with language or awareness around how to articulate some aspects of their sexuality. And so this document, I forget how many questions are on there. It's a lot. So it's not intended to be something that you read, front to end and all at the same time. But there may be some questions in there that support an understanding more of, like, what was sexuality like in your house growing up? What were the messages around your body? It asks questions around function, dysfunction, pleasure, connection. What are your values as it relates to sex or not? So that document really helps spell some of that out. So yes, that's available for free, and anyone can go and download it right now. But I think creating some space in your in your work of how this is an essential part of your client's life, whether or not they are bringing that in voluntarily, and holding that awareness as you're working with them is
Yeah.
key. And it's a key part of your conceptualization, your overall conceptualization, regardless of whether there's a sexual concern at the forefront of your work
Yeah.
with
That's the
someone.
part that I kind of want to pick back up on just to go a bit deeper with, because we've mentioned the ghosts that might be there giving the connotation of sex to all of us. They're the cultural, the moral, the parenting, the social that could help or could make a person feel this is a bad topic, or I just am immediately charged with avoidance energy. So when we're talking about sexuality in this way, the way we are in this conversation, it's different than that. But these ideas of pleasure and desire and just embracing that side, those are intimately interconnected in a person's self-concept and the way they go into social relationships, just how much permission they feel they have to talk about that or explore that or experience that it could be just play related. Like I can own my desire to just have a fun and energetic and good time with this space. And I also have the ability to choose if I want to explore a more intimate relationship with this individual or system or whatever. But that messaging to me is just as important as explicitly negative sexual experiences, so to speak, in a client's lived experience.
Exactly right. I mean, if you think about any client that you work with some kind of trauma history, especially those with more complex trauma, their relationship with feeling good is often very distorted.
Yes.
And essentially that's what we're talking about with pleasure, right? Is do you allow yourself to feel good and experience pleasure? And even as I say that, you could imagine maybe what some of your clients will already tell you, I don't deserve pleasure. If I start to feel good, that means I'm unsafe and I can't, right? There's all these stories that get attached to these things for people. And I think I love that you brought in play, because I think of sex and sexuality as adult play or consensual play. And that is an important part of our ventral vagal circuit and regulation. And like, there's a huge resource that we can unlock with this. Again, we're not talking about specific sexual acts necessarily. It's more this energetic eroticism of feeling good and accessing pleasure. The other piece that I want to pull in here is that we can only experience pleasure in the present moment. And one of my favorite quotes from Jamie Marich is the opposite of dissociation is mindfulness. And I want to link that together with pleasure as, like, to me, pleasure is like this river that's flowing over these rocks of numbness and dissociation. And the more that we allow that pleasure river to flow over these rocks, they smooth, it gets easier, and actually more pleasure can flow. And I think that's so true. And essential part of trauma healing is ability to be present and experience safety in the present moment now. And, play, pleasure, presence, these are all essential aspects of our work. And again, this is a component of our overall health and wellness.
Yeah. It's making me think of, as we're collecting history, I'm even thinking of our developmental timeline that we teach, and that we're not just collecting history on the experiences of trauma, but we're looking at the adaptive experiences as well, because our work as an EMDR therapist is not just to desensitize, but it's also to install and to develop and to build off of the adaptive. So kind of adding that into this exploration of history around sexuality, of kind of reiterating what you were naming, Bridget. It's not just asking about the trauma,
right?
But where is it healthy? Where do you have 10% more safe expression of your sexuality? And is there room to grab onto something that is like a budding adaptive expression and start to build on that? And I think that can maybe even be a softer, more gentle approach to working with sexual disorder or, sexuality in general, rather than just starting right off with where is the complication, where's the problem, where's the wounding. Could we start with where is the health or the adaptive expression and expand upon that?
Mm-hmm. Yeah. I think that's so true. And The other piece that I'll just add in to kind of fill it out is I think it's not only like, shifting away from dysfunction or disease, it's also performance that I think gets caught up in here when we talk about like sexual health. And it's, again, more focused exactly what you're saying there, Jen, which is on the felt experience
Mm.
of pleasure, embodiment. Pleasure is the measure of healthy sexuality, actually, more than anything else. And so, can we develop and add like a pleasure element or a feeling good element onto this history of like where are these moments, these access points of resource and feeling good?
Yeah. Do you work primarily with individuals or do you see couples as well?
I do both. My sweet spot is working with women or people socialized as women.
Gotcha.
In their sexuality now.
Yeah, because this whole conversation, I think it's because a lot of my clinical focus is in couples work, that these are really beautiful ideals that we're speaking to. And I think really important clinical pillar, like foundational pillars to have. But the part of the conversation that I'm kind of curious about right now is in what about the immediate moment of once they leave the session going home back into an environment that might echo or reinforce some of these negative messages around sexuality or limit or completely reject the healthy patterns of getting in touch with pleasure or being in an embodied focus around my sense of desire and feeling good in my body. Because I think there are a lot of circumstances that a couple might come into my office and they are in a good relationship with each other, but they're somewhat subconscious or unconscious to the ways in which that relationship reinforces some of the messaging that they've grown up with for a long time and maybe has some problems with consent when it comes to sexual intimacy with each other, but they don't have the language to navigate that, or they don't have the ability to name, okay, I am not feeling sexual right now, or I'm not feeling interested in this type of encounter. So how do I navigate that without you feeling shut down or rejected, or me feeling shame-filled and guilt-ridden for saying no to this moment? Just a lot of elements of my clinical practice that this is a beautiful thing that I continue to echo in session, but then I'm met with, yeah, but it's really hard. And that's what we spend a majority of our time working on is, yes, it is. I totally understand. And so let's work on that.
Yeah. Yeah, it's so challenging. And we see that just in all of our trauma work that we do when we're trying to help our clients live into something different. And yet when they leave our office, they're confronted with all the contrary that tells them it is not safe and it may not be safe to do something different. So I think that just to validate and normalize that, that's very real and very challenging. I do think there's some opportunity, while it's not an answer or a fix to your question entirely, I think there are some, well, let me say it this way. I think about 80% of sex therapy is good, accurate sex education and updating and providing what so many of us never got, which is what is a healthy sexual relationship? What does healthy sexuality mean to me? And some things that I anchor into, especially when we're in these really tough moments, as like, what are the things that I can really hang on to? Are 6 principles of sexual health, which include consent. These come from Douglas Braun Harvey. These are not mine. Consent. So you have the right to give and take at any time for any reason. Non-exploitative. So that means living free from someone having power over you. It's honesty with each other, sharing your values of what's important in a partnered relationship, prevention from illness or other diseases, and then pleasure, which is so individualized and so unique to that person. And if someone can't cultivate these principles within the context of their relationship structure or constellation, cultivating that an individualized understanding of what is sexuality what is that going to mean to you, and how can we reclaim that for yourself in micro ways that feel safe and exciting, right? Like where those things meet, that's where we're going to to work, right? We're not going to push anyone beyond what feels safe and not exciting. That wouldn't even work. So
yeah.
Yeah.
Yeah. I'm giving the listener pause for if you want to rewind and listen to those 6 principles
Jot
again. You
those
can do
down.
that now, because that's to me just a beautiful kind of takeaway. And as you listed them, I'm thinking about my clients and the ways in which they're already culturally predisposed to be asleep to those things or have really negative experiences around each of those 6 domains. So
I love that you used the word asleep.
Yeah.
I think that is a really thoughtful, accurate word. Mm-hmm.
And the cultural context or the projections that we put into each of those domains based on what, one person determines is appropriate, inappropriate, acceptable, unacceptable, good enough, like all of these standards. I feel like you could go through each of those in a phase of exploration with your client and even explore like what templates do they have for each of those categories? What is the template you come in with around consent?
Yeah.
Just starting there.
Yes.
And what does that mean to you? Like there's such depth and rich material there that we all have conditioned. That label activates a certain template that we assume means something. And can we come back and be curious about that and maybe add in new information? I love that reference to like so much of it is just about educating what does all of this mean and what does it mean to be healthy in these ways?
Yes, I want to highlight one thing you just said, which is it is not for the therapist to prescribe what healthy sexuality is.
Yeah.
It's for them to be with these principles and wrestle with them to determine what healthy sexuality means to them. That's so key.
Mm.
And it's so countercultural to what we've all been given from whatever system that prescribes us, what is a good body, what is good sex, what is appropriate sex, all of those things are so prescriptive in our culture.
Yeah. Yeah. I'm thinking about the conversation arc that we're kind of on, and it feels like there's a lot of the education mindset kind of in the time we've spent together already of what is sex and sexuality and pleasure and why is it important. I'm curious if we could kind of shift to talk a little bit more about the integration with EMDR of now we have this foundation laid of what is sex, what is pleasure, what is, desire, these things. What could happen to us that alienate us from our own sense of permission to feel pleasure or experience that, issues with consent and self-concept. But now how do we integrate this with EMDR? So big question over to you, but I would love to hear your response.
Yeah, I have found, I'll just start with this. I have found that EMDR therapy to be such a gift and an asset to integrate within sex therapy, but all therapy that I've done that has had some kind of sexuality component to it, because it is so expansive, so client attuned, and I think really helps us clarify and give a beautiful way to understand sexual concerns that, even my sex therapy training, which was very behavioral, very medicalized, like let's look at the sexual dysfunction and then here's the CBT technique that's gonna, Not that there's anything inherently wrong about those things, but to use that exclusively
right.
was so limiting. And so, I got trained as a sex therapist first, and then I got EMDR.
Okay.
And so then there was this wrestling of like, how do you integrate these things, right? So a couple of pieces that I think are true, regardless of whatever you're doing with EMDR, is that we are looking for the things of a non-organic basis, that the experiences that are maladaptively stored or stuck, that are pushing this symptom or this dysfunction or this concern. One critical aspect of the history taking with EMDR that I think is valuable to start with is like ensuring that there isn't something of an organic basis, meaning something physiological, medical, biological that is driving whatever the sexual concern might be. So, for example, if someone is experiencing pain, like vaginismus, for example,
Yeah.
You would want to ensure that your client is speaking to a gynecologist and having an evaluation to determine, like, that may not all be past experiences that are generating that pain for someone. There's likely some aspects, and even the nature of having pain like that is traumatic. And so there's certainly going to be lots of experiences to process no matter what. But as far as the genesis or the origin or, what's laying the foundation for this, we want to rule out medical things or have those things treated. From there, I think there is so many experiences, cognitions, sensations, emotions, the whole cluster of memory components are rich in this domain. I mean, there's endless things that you can work with here, like you would with any other issue, as you do with EMDR therapy, right? Performance anxiety, for example, for let's say a male identifying client is very likely experiential. It's something that has been learned and conditioned. And so, yes, we can absolutely use EMDR therapy to help unravel and unhook some of those things. So a really good case conceptualization is first determining what is actually workable within the mechanism of EMDR and how we know it to work or how we understand it to work. And determining what's again safe and manageable for that client to work on at this point. For example, if someone has a chronic, they come to you. This is a very typical case that I'll see in my office. A woman will present for treatment because she has low sexual desire per her partner, and wants to fix that before things continue to implode in the marriage or in the relationship. And upon history taking, you learn, okay, right now you're experiencing low desire, you have a very stressful life with 2 young children, you're very stressed out at work, and also upon further exploration, there's sexual assault that you had in college and actually sexual abuse as a child. And so here you have this big treatment plan already. You can see all these different components of things that could be worked on. And so I think it's important to build your map, your case conceptualization around the full picture as much as you can.
Yeah.
Right. It could be really tempting, someone presenting with low desire to like want to take a hammer and hit that nail of like, great, we're going to find all the fantasy books and we're going to find like all the meditations and the hypnosis and all the things.
All the ways we can. Yeah.
These are these CBT sex therapy things. Like, here's all my hammers and my nails. I'm going to just fix it for you. But as EMDR therapists, we know that there's so much more that underlies that would not even make those behavioral techniques effective.
Yeah.
And so partnering with your client to determine what's safe and manageable for us to work with was what's stuck in the past. Maybe it's a message around purity culture that you got that's impacting this. And then working in a very standard way. I'm a real standard protocol gal. And that doesn't mean going to the first or the worst. It means, but using the core tenets of what we know is really effective for reprocessing to appropriately dose the EMDR with someone.
Yeah. Beautiful. I'm very curious about resource development and installation of when you said you're a standard protocol person, like, is that also, okay, we've got our calm, safe place and container, or do you also change the way in which nurturing figure, protective figure, other ideas of resourcing might come about for them?
Oh, yeah. We take lots of time to resource. Yes, I think a big aspect of resourcing, and this mimics, I think, how I think of sexuality, which is this like beautiful, generative, creative potential. I mean, literally as the output of having sex, women can create, literally. We can create together. So we want to bring that creativity into our resourcing as well. So I'm not saying anything, like safe, calm place, container, light stream, all beautiful things. And you really want to look at the case, how you're conceptualizing your client, and determine what's the adaptive information that's missing or needs brightening or building
Yeah.
in order for this EMDR to take, right? So for many people that are presenting with, let's say, for sake of this conversation, someone is coming directly for a sexual health related issue. Um, we want to ensure that they have access to their body. And for many people, they may not. And so using resourcing to help develop a way to make connection with the body and enhance that. Um, the next step would be to allow yourself to notice feeling good in the body, which could be massage. It could be, I have these like really interesting pillows in my office. So like, let's play with the pillows and just notice those textures and notice what that's like inside. And let's add some slow tapping to that.
Mm-hmm.
Right. So I'm taking these micro moments to try and install these pieces that I think will often be missing or needing um, some support in order for that to reprocessing to work. So embodiment, tolerance for pleasure or feeling good, having some kind of attachment figure could be useful as it relates to someone who has like a vivacious energy, like a sexual energy that is inspiring to you. I have a client who has a very has historically had extremely low desire. She said she'd rather, do just about anything else than have sex with her partner. um, but had a very active romantasy, like romance fantasy
Mm-hmm.
uh, obsession, like loved the characters in these books where there were so many sexual and romantic themes. So we pulled from this, right? Like we pulled some characters from this series that she loves and installed those as figures for to access something, right? So yes, phase 2 should be very dynamic, very creative, and it should directly mimic what's happening in your case conceptualization to support the processing work that you're going to do. And I think, um, well, yeah, never mind. I won't go down that path right now. Yeah.
Well, yeah, I so appreciate the language, and it mirrors our emphasis in phase 2 and RDI with just creative resourcing, that it matches the content and the themes or dynamics that the client is actually experiencing. If you want to start with your generic kind of out of the box of EMDR resources of calm, safe place, container, that's great. But along the way, you're going to listen in and find experiences that highlight the need for a resource that wasn't previously there. And so that's an excellent opportunity to develop that. Another emphasis that I bring into that space is looking at, we use Jaak Panksepp's affective systems and circuits very centrally, but where sexuality linked to primarily desire circuit may be entangled with rage or with fear and anxiety or with panic and grief. And so when we have somebody that's like, I don't want anything to do with sex, there could be a lot of that going on. And so while you're unhooking, as you said, from these earlier templates and experiences that they have, how can we also then connect it with play and nurture and seeking and these different ways of experiencing more of me than what was previously conscripted? When desire was there, it was always met with rage or was always met with fear and anxiety or panic and grief. So how can we just open up the opportunity for more of me to be involved in what I'm doing and let that be a positive and consensual experience?
Yeah. Love all of that.
It's so cool to see. I had not, coming into this conversation, I had not thought of sex therapy from its primary benefit being in the conceptualization realm. It was more in that mindset of, I think a sex therapy certification probably teaches all of these different interventions or approaches or solutions to use. And it's so supportive to see the benefit really is in how are we conceptualizing and looking at this as a whole, and it really being a primary element of self, just as we would consider culture, ethnicity, spirituality, all of those elements of concept of self, it being a primary element of that. And then really the rest of it just kind of unfolds naturally. As far as the rest of what you said of like integrating it with EMDR, it's like, oh, that's how I would treat anything. That's literally how I would approach resourcing with any special focus. And so the rest of it can kind of unfold when it's held as a primary element of understanding the human that we're working with and the wholeness of their humanity.
Yeah, well said. Good summary.
Yeah. I'm curious, Cassie, just looking at the conversation as a whole, what, if anything, we haven't touched on that you might feel important that the listeners kind of are aware of this or are thinking about this?
My hope for some folks listening to this conversation, I hope it sparks some self-reflection and some curiosity around your own relationship to these concepts. Certainly for your clients, but I especially want to invite clinicians into this process. And I'll speak for myself. I entered sex therapy in retrospect to solve a problem for myself, which was I don't know what this is or anything. So I need to fix it. And as a result of this training process, it sent me on this journey that has been so rich and so meaningful personally and professionally. And I think this is often where we clinicians can stall out is I can hold a lot of interest and curiosity for this topic because of my clients. I'll do it for my clients. I'll reflect on this because I want to do good by them. I want them to heal and I want them to, have a beautiful, pleasurable life. And we often miss ourselves in that process, truly. And my hope is that clinicians and those listening can really take the time to reflect on this, what this means for them and what it would mean for them to really locate their own eroticism within their personal life, but also in the therapy office. And it is not something that is going to feel comfortable or natural. It might feel awkward or strange. And it can feel uncertain to know, is it okay for me to even think about this?
Yeah.
And I want to give you permission that it is okay. And this is your body and this is your sexuality and it's unique and it's totally normal, whatever it is.
Yeah.
And I hope that this conversation can spark a different kind of trajectory for listeners to create this space and make them understand that sexuality is their birthright too, not just for your clients.
Yeah. One of the things I practice with couples just came up as you were sharing that let's find a safe partner to even start talking about it with. Like, it does feel weird. And until you start talking about it, it's going to continue to feel really weird and scary. So in a non-sexual context, just starting to I just say the word sex, like, or whatever the invitation might be that just breaks the ice enough to where curiosity can come forward or just interest even. And I think for therapists as well, if you're not used to conceptualizing around sexuality for your clients or thinking about it in yourself at all, is there a safe colleague or somebody that you can have conversations with about this? Because that to me is a really important practice before you start getting it into the room with clients. Can we get used to hearing our mouth make the sounds of talking about sex or talking about pleasure before we take it into the room? And
Yes.
Cassie, for the listeners who would love to learn more, connect more, where could they find you?
Yeah, you can find me in a couple different places on the internet. So my training group that I work with, Iris Training Collective, you can go to our website, iristrainingcollective.com, where we're offering trainings all the time on EMDR and other trauma responsive topics for therapists. I am in the midst of writing a EMDR advanced training on sexual health and pleasure.
Nice.
So be on the lookout for that. That would come up at the Iris training website. And my private practice is inneratlastherapy.com. And I also have a podcast called Taking Up Space and another podcast with my co-founders at Iris called Therapist. So lots of material and content is is out there. So you Google my name and you'll find me. But yes, I do hope folks take a look at the history taking form that they can access at any time for download if they're interested in something tangible.
Yeah, I'll put that in the show notes so that people can access it really directly. Yeah.
Perfect.
Thank you so much for your time, Cassie. It was a real pleasure talking with you. We'll hang out here after I stop recording to say goodbye kind of separately. But it was a pleasure having you on. Thanks so much.
Thank you both so much.